An unsanctioned so-called pop-up safe injection site in the heart of Ontario's capital city. Firefighters across the city equipped with overdose kits. Harm reduction workers calling for the province to declare a state of emergency. Ontario's capital city is staring down a deadly spike in opioid use and overdose. Is it getting a handle on the problem? Let's ask. Joe Cressy, Toronto City Councillor and chair of the city's Drug Strategy Implementation Panel. Joe, it's good to see you again. Thanks for coming into TVO. Let's just set up this discussion with Sheldon, if you would, bring up these facts here. Here's what we're dealing with right now. Between the years 2004 and 2015, that's the most recent years for which we have data, there was a 73% increase in overdose deaths in Ontario's capital city. In 2015, 135 people died from an accidental opioid overdose. Those are the numbers. How would you describe the current situation in Toronto?
Well, it's a growing crisis. 10 years ago, we had 146 people die due to overdoses in the city of Toronto. In that time, the number of people dying from overdose has been going up every year, and it's escalating rapidly. And so it's a crisis, it's an emergency, it's an epidemic, it's killing people, and these deaths are preventable.
Do you expect it to get worse before it gets better?
I'm afraid it will. What we've seen is that while we've had an overdose crisis in Toronto for a decade, in the past, a lot of those overdoses were primarily habitual drug users. It was a crisis then and it's a crisis now, but what's changed is with fentanyl, which is an extremely potent opioid being cut and laced into drugs, both habitual drug users but also recreational drug users are at risk. So increasingly, we're seeing somebody do ecstasy at a club, somebody do a line of cocaine after work. They're also at risk. And so this overdose crisis, in effect, it's the gentrification of overdose. And it is here, and as long as fentanyl continues to come eastward from British Columbia and Alberta, where it's wreaking havoc, it will get worse.
You and others, frankly, have called for the province to declare this a state of emergency. What would be the value in doing that?
Well, there's no silver bullet to solving the overdose crisis. At the end of the day, increased treatment, increased prevention, and harm reduction initiatives, they're all needed, and every single level of government has a role to play. The city can't solve it on its own, nor can the province or the feds. Why we've called it the City of Toronto through our Board of Health for the province to declare a state of emergency is because, first of all, it is an emergency. People are dying in increasing numbers in Ontario, but also the tools that are proving to be successful in combating this crisis are tools that are largely illegal. And therefore, we need new measures, we need bolder steps from government to try new things, to think outside of the box if we're going to get a handle on these deaths.
We did ask the province for a response to this request for a state of emergency, and here's what a spokesperson for the Ministry of Health and Long-Term Care told us. In Ontario, our mechanism to declare a provincial emergency is for events that are expected to be of a time-limited nature. The opioid crisis is extremely urgent. However, unlike a flood or a disease outbreak, it is not finite. It is not short-term. It has been and is continuing to affect our communities. Throughout this past year, the ministry has been dealing with this public health crisis, and it is going to continue to require a long-term government response. Obviously, this sets up to a conclusion which says the conditions are not right to declare this a state of emergency, and therefore they're inclined, at the moment, I guess, not to do it. To which you say what?
Well, I guess, listen, at the end of the day, actions are more important than the words. And on that basis, I completely agree with the province that you can call it whatever you want to call it, so long as we're taking the appropriate steps. Those steps being increasing funding to harm reduction workers, getting naloxone, a life-saving antidote, distributed more widely. Here's where I think we're in a unique situation in Toronto and the province of Ontario. The measures that are proving really effective in combating this overdose crisis are largely overdose consumption sites. These pop-up sites that are opening, technically they are illegal, but they are proving to be the first line of defense to allow people to use drugs in a safe environment and to stop these deaths.
So are you okay with them? The pop-up sites?
They're necessary right now.
Even though illegal?
Even though illegal. And this is where I think in the province of Ontario, we need to think a little more creatively, and in the City of Toronto, which is to say, in the midst of an emergency, in the midst of a crisis, if the measures that are proving to be effective in stopping people from dying are technically illegal, then if a state of emergency will help us to respond to those, to give us the latitude to try new things, then let's do that. But at the end of the day, the status quo response that all levels of government are doing is not enough.
Well, the province of Ontario did come forward with $222 million over several years as a response to what's going on right now. Your view on that?
Well, listen, all three levels of government, the federal government, provincial, and us at the city, there's an important agreement that this overdose crisis requires a public health response, which is to say you can't arrest your way to a solution. You need harm reduction measures, you need to be distributing clean needles, you need a lot of things on the table. I guess the challenge is, notwithstanding the province's impressive steps forward, the $222 million in funding announced in August, the support for supervised injection, just like at the federal government and just like at my level in the city, we need to do more.
Well, opioid emergency task force, the province also said it would set up one of those. Is that the kind of more you're looking for?
So that's an important process piece. The emergency task force is to ensure that in responding to this crisis, we're listening to people on the front lines. Here's in British Columbia. Let me paint a different picture. In British Columbia, where data came out just the other day that showed that 1,000 people in BC have died already this year due to overdoses. 1,000 people
in 2017.
In 2017. In 2016, they lost 900 people in the entire year. They've already crossed that threshold. Now, what British Columbia has allowed to take place are a whole range of responsive initiatives, including overdose consumption sites. These are pop-up sites. There's 22 of them in Vancouver alone. They are technically illegal. But the provincial government and in Vancouver, the city government has said, you know what, they work, they're necessary, and we need to get a handle on this emergency.
Do you expect we'll take the same approach here?
I think we should. And this is, it can be an uncomfortable conversation, Steve, I get it, which is, how do you encourage people not to use drugs while condoning drugs, or the appearance thereof at the same time by allowing people to use?
Well, and not only that, how do you expect people to follow other laws that they may not like when here's a law you don't want to follow because you don't like it?
Well, and I guess the answer is drug use is complicated. People use drugs for lots of reasons. You're dealing with trauma, you're dealing with self-medication. Therefore, the policy response has to be complicated as well. And on that basis, if a law is resulting in the unnecessary loss of life, how can you blame people for breaking the law? Which is precisely why all three levels of government need to think differently about drug use and the law that exists. You know, in the United States right now, Philadelphia, for example, 1,200 people have died this year. Their answer is just say no. Arrest your way to a solution. It's resulting in more deaths, right? That's why we need to think differently. And I think at all levels of government, we need to recognize that the solutions to the current overdose crisis require us to think differently about drug use.
Well, one of the ways you wanted us to think differently is to set up some safe injection sites in the city of Toronto. I'm trying to remember now, was it 3 that was the original plan? Where's that at right now?
So we approved last year 3 supervised injection facilities in the city. I recall a few months ago, you and I had a good conversation about it. So one of them is open near Yonge and Dundas Square. It's been open since the end of August, and the results are impressive. We've had 465 people use that site. We've had 5 overdoses reversed. So 5 lives have been saved on site because of that program.
How do you know that, Joe?
We know that because had those overdoses had we not administered naloxone, had somebody not been there to administer a life-saving antidote, it is likely it would have been a fatal overdose.
I see.
And so we have seen that that model has worked on that basis. The other 2 sites, one of which is located in my neighborhood in downtown Toronto, construction is underway. We're looking to have them open as soon as possible. But when we approved these 3 sites in Toronto, it was based on a study 6 years ago that said, based on drug use at the time, these neighborhoods, 3 neighborhoods, needed to have this health response. Well, the pattern of drug use, the spate and increase in fentanyl use has increased at such a level, we now need to rethink this. We're now looking at more sites in the city.
How many more do you think we need, and how many more do you think are going to get done by if we have this conversation a year from today?
Well, right now, Toronto Public Health at the city is in the process of researching which neighborhoods would benefit from having sites. I suspect that we'll see 3 to 5 neighborhoods come back in the research in need of these sites. The sooner we get them open, the more lives we'll save. Listen, I think at the end of the day, this is about a sea change in public policy. It is about seeing drug use as a public health issue as opposed to simply a criminal justice one. And it's about reducing harm.
But if it's not the hardcore cases that are now, not only the hardcore cases causing a spike, but recreational users as well. Recreational users, I suspect, are not going to go to a safe injection drug
they're
site.
not. Yeah.
So what kind of impact can we really expect these sites to have?
So here's what we're doing in Toronto. You're absolutely right. If somebody is using drugs recreationally after work, they say it's cocaine, or if you're a 20-year-old going to a nightclub and trying ecstasy, they're not going to go to a safe injection site. Mm-hmm. You're absolutely right. So through Toronto, we've developed an overdose action plan to deal specifically with that side as well. Here's some of the measures we're doing. We've been partnering with local restaurants and local bars and local clubs to do overdose training so that the bar staff themselves know how to recognize overdoses and so that they have naloxone, the life-saving antidote, on site.
You want that to be a law in the province of Ontario, that you've got to have naloxone on site?
Well, I'm not sure you can make it a law. You could do it as part of a smart serve, where whereby servers have to have a smart serve training. You can incorporate overdose training into it. I'll tell you, in my experience in downtown, I've co-hosted 2 of these sessions. In Kensington Market, famous neighborhood in downtown Toronto, we partnered with the local business improvement area to do an overdose training. We had 146 bar and restaurant staff volunteer in an evening to come out and be trained. They came out on their own accord because when we asked for a show of hands how many people knew somebody who was impacted by an overdose, nearly every hand went up. Yeah. It's hitting all of us. And so do we need to mandate some of this legislation? Sure. But what we're actually seeing is that people are asking for it themselves. So bar and restaurant staff are being trained. We're partnering with music festivals right now in the City of Toronto to look at having drug testing on site so that people can come and have their drugs tested. I mean, this is a sea change in how we think about drug use, but it's also a critical sea change in terms of how we prevent deaths.
This is not you know more about this than I do, so you help me out on this. This is not exactly something where somebody's going to fill out a form for StatsCan, and therefore you're going to have good, reliable data in order to help inform your policy decisions. So where are you getting your information that helps you make good decisions on this?
Well, as it relates to the data itself, it's slow coming in the province of Ontario. The data comes primarily through the coroner's office and toxicology that's done after the fact. The challenge with the situation in Ontario is our data is a year out of date. In British Columbia, they're getting real-time data monthly. It's really hard for us in Ontario and the city to respond to changing dynamics of drug use and changing types of drug use if we don't know where it's happening. So data is a problem. The other thing we're doing is, and this is what we've done in the harm reduction community for years, is our own work. So reportbaddrugsto.ca. It's a website we set up a couple years ago where people who use drugs, who notice problematic drugs are in the system, they report it online.
Say it again,
reportbaddrugsto.ca.
Reportbaddrugsto.ca. Okay.
And so that's where, in addition to through the coroner's office, getting real-time data using toxicology, and that needs to come much quicker, this is peer-to-peer basis, people who use drugs trying to warn others. It's harm reduction. I mean, I always say, if I have a younger brother, if he used hard drugs, he doesn't, but if he did, I'd want him to stop. But I'd want to keep him alive long enough that he had a chance at stopping. And that's what these initiatives are about. Keeping people alive, reducing the harm, but at the same time ensuring you have adequate treatment resources in place so that people can access treatment to get off drugs.
We're down to our last couple of minutes here, and I want to ask you a very harsh question, which I think is going through the minds of some of the people watching this right now, which is, why do we care?
Fundamentally, because these are people's lives, and drug use impacts everybody. Every family has a story, whether it's a son or a daughter or a cousin. And just like we treat healthcare, and we talk about if somebody has cancer, we care, and we're there with treatment. If somebody's dealing with mental health issues, we're there and we care. Just as if somebody uses drugs, we're there and we care. And it comes back to what is, at the end of the day, the role of government. And if you believe that the role of government is to take care of people, whatever the circumstance, whatever the context, whatever the affliction, then the role of government is to understand that there's no lesson to teach people by letting them die. There's no smart lesson there. The lesson we can learn from drug use and the rising overdose crisis is that if we respond differently with a public health approach, people can lead healthy lives. That's, at the end of the day, what we should be doing as government.
Gotcha. That's Joe Cressy, Toronto City Councillor and the chair of Toronto's Drug Strategy Implementation Panel. Joe, it's good of you to visit us at TVO tonight. Thanks so much.
Thanks, Steve.
Help TVO create a better world through the power of learning. Visit TVO.org and make a tax-deductible donation today.